Hello, and welcome to the latest episode of Living with and Beyond Cancer. My name is Steve Poynton of Steve Poynton Counselling and Support. This is a podcast for people who have or have had cancer. As a twice diagnosed kidney cancer patient who's been in remission for 7.5 years, I recognise the trials and tribulations of what happens next once we finish treatment or are on long-term maintenance treatment and try and return to our lives. Before we get into today's episode, if you want to know more about myself and why I'm doing this podcast, please go back to episode 1, released on World Cancer Day on the 4th of February 2026. Welcome to this latest episode where we'll be exploring the story and the thoughts of Dr. Alex Turner. But before we hear from Alex, I would just like to say a few words about a sponsor of the show, Corporate Wellbeing Solutions. If you're a business owner or managing a team, it's worth checking out Corporate Wellbeing Solutions. They specialise in occupational health support, providing high-quality, practical reports with a really fast turnaround, so you're not left waiting when you've got live employee situations to deal with. They also offer an employee assistance programme giving your staff access to qualified counsellors, along with mental health and wellbeing support whenever it's needed. If you want a straightforward, reliable support that actually helps you manage your people properly, have a look at Corporate Wellbeing Solutions and email them on occhealth@corporatewellbeingsolutions.com. So, welcome, Dr. Turner. Alex,
Yeah.
would you like to introduce yourself, where you're from, etc., etc.?
Yeah, so I'm Alex. In 2024 I was diagnosed with stage 3 breast cancer, and then I received a second, it's almost exactly the same diagnosis the following year. So turns out it was actually bilateral breast cancer. And I am a psychologist, so I'm not a medical doctor, but I am a psychologist, and I've got a PhD in performance psychology, and I work largely in sport, but any sort of high performance domain, but largely with elite athletes and elite sporting organisations. And one of the things that we do primarily is understand how the individual interacts with their environment and how that impacts on performance and well-being. And they're sort of symbiotic. It's very difficult to separate performance and well-being. And so when I received my own diagnosis, I drew on that expertise and that knowledge and the colleagues that I'm surrounded by every day and the work that I do every day. And actually the parallels are quite obvious when you start to look at them and understanding. I think that's how I then approached my diagnosis and my treatment and my recovery, was around not just trying to understand what was happening inside my body, but also understanding what was going on in my environment that maybe had led to those diagnoses, and what did I actually need in order to be able to recover as well as I possibly could. And I found that massively beneficial, and so work quite hard now at trying to share that with other people and help people to understand the emotional and psychological impact of cancer, and the emotional and psychological needs that we might have in order to recover well.
Sounds fascinating, and obviously somebody who's a mental health background like myself, I'm really looking forward to digging into this and hearing some of your thoughts. So take us back a little bit. How did you get into this sort of career and profession?
I did my undergraduate degree in psychology many, many moons ago, and then I just knew I wanted to work in sport. It's something I've always loved and been passionate about. And I was just really fortunate. I think really early on in my career after university, I got a job working for the International Tennis Federation. And I worked there for 4 years, and then I went to work for World Rugby, and I was involved in event organisation. So I worked on Rugby World Cup, and then later went back to the ITF, the International Tennis Federation, and worked on Davis Cup and Fed Cup, they were called at the time. Travelled all over the world. It was around organising the events and largely around sort of team services side of it. And I always knew that I wanted to sort of put the two back together and do the psychology bit within sport. And so at one point, I can't remember when I decided, I think it was about 15 years into my career by this point, and decided I'd go back and do my master's in sports psychology. And then the opportunity to do a PhD with the RFU, the Rugby Football Union, came up. And so I applied for that and got that. And then spent a lot longer than most people do doing their PhD, because I had my children during that time as well. And that was looking at their performance pathway and the efficacy of their performance pathway, and looking at the psychological factors that allow people to perform at a sort of super elite level. So the best rugby players in the world, what are the characteristics that they have? And what we found in the research supported other research that was there around Olympic athletes as well, but it heavily talked to not just the traits and personality characteristics that they have, but also the environments that they've been in and how they've shaped them and shaped who they are and how they're able to perform. And then after finishing my PhD, I worked on a project with an organisation called Changing Minds, and I'm now still working for them. And we have a team of sport and clinical psychologists, and we work into, as I said, different elite performance environments. And that might be sport. It's predominantly sport, but it might be corporate high performance environments as well. And we very much look at that interaction between the individual, the environment, and what it is they're trying to do.
So, how do you feel over your progress or duration of your career, should I say, sort of psychology in sport has developed? Because as somebody who's big into sport personally, um, I think even back 10, 15 years from the outside, it wasn't as prominent as possibly it is now. You see a football team, for example, has got ahead of this, head of that, and psychology seems to be more. And I remember reading a book by Gary Bloom. I don't know if you've come across Gary. And he used to be the football commentator on Channel 4 for Italian football years back. But he was the first football psychologist, I think, at Oxford, employed by a football club. It was
Oh,
fascinating read.
nice. Yeah.
But yeah, do you think it's developed in sport over a period of time?
Yeah, hugely. I think if I tell people what I do for a living, most people think that that is supporting athletes get over their anxiety in order to perform. And I think that sort of is what most people's understanding of either sport or any sort of organizational psychology is about, is sort of working with the individual. And that's not to say that we don't do individual work. We do work with individuals. But actually, what we're looking at, even when we're working with an individual, is the influence of lots of different things. And I personally tend to work more strategically and work within organizations and advising organizations. And often it's about understanding the environment that somebody is in. And so I often talk about this in relation to illness and specifically in relation to cancer, because that's been my experience. But these things don't generally happen in isolation. Our wellness and well-being is hugely impacted, or our performance is hugely impacted by the environment that we're in. And that's really individual for each of us as well. So what environment might allow me to thrive might be really different for you. And so understanding that and understanding the history and the personal characteristics that somebody brings to their environment and how those two things interact together it has a profound impact on performance. And so that's generally what we're talking to either individual athletes or their coaches, performance directors, the people that are around them about. And actually it might feel like a bit of an indirect influence on their performance, but it's hugely profound. When you can get that right and that goodness of fit right, we've seen some really amazing results from that and outcomes from that.
Yeah, and in elite sport, it's fine margins, isn't it? It really is. And literally anything that can give you that extra millisecond has got to be taken seriously, hasn't it, these
The
days?
best example of it, I think, is when you see, and it happens in football quite often, but in lots of different sports, but when you see somebody performing really well in one environment and then they get transferred to a different club or bought by a different club, and then the performance is just really different and they don't perform it to the same level. And people tend to blame the individual for that. And we see the fault of that as performance as sitting within the individual, as opposed to saying, but there may be numerous factors. They've now working with a different coach. They're working with a different team of players. They're working maybe further away from their family and friends. Maybe there are other things about that environment there's all sorts of factors that will influence them. And so we often work with clubs who are about to make those sort of big decisions and high risk, high finance decisions to say, actually, you're not buying this person who has this ability to perform like this in every environment. You need to look at how they're going to perform within your environment. And often that's not what people think about. They just think about the physical stats and whether that's the type of player that they want to buy, the style of play. Um, and I think there's a lot more to consider than that.
Yeah, it's massive, isn't it? People on the outside who just watch sport often don't understand how difficult that is to settle into a new environment, especially if you look at a foreign player coming from abroad who's
Yeah.
been banging in the goals, if you like, and then suddenly they're living in a hotel room for 6 months on the other side of the world, and people wonder why it takes them a while to settle.
Yeah. And even as nuanced as, diet changes that might happen because of that new environment and things that they're not used to, and just the relationships they might have with different people might bring out the best or worst in them. And it's even the way I'm describing it's probably oversimplifying it, but there's so much nuance in that, and understanding that for the individual and understanding who they are, what their story is, what their background is, what their previous experiences have been, what makes them tick, what makes them work well, what allows them to work under pressure, what allows them to feel challenged and supported, and all those kinds of things. It's really important to how they're going to then perform within in your environment.
Absolutely. So if we come on to you slightly, where did you start to feel something wasn't quite right health-wise for you? What happened?
My story is a little bit like mine was a really late diagnosis, hence the reason it was stage 3. So I probably had symptoms for about 6 months before my diagnosis, the cancer was picked up, and I was going backwards and forwards to the GP and to the breast clinic, and I had mammograms and scans that were coming back all clear. So was told everything's fine. And when I asked what was the issue, was told we don't know, but at least it's not cancer. So the hospital was comfortable that they'd ruled that out. So I sort of took that for granted, I think. And I think also the context of I was living it with chronic stress at the time. So I'd lost my own mother to cancer not that long before. In fact, I lost my mum a couple of months after I got married and a month before I found out I was pregnant with my first child. So it was a really difficult period of time. I had 2 very traumatic births, and hemorrhaged blood during both of my children's births to quite an extreme level. Physically very depleted, and I was doing a PhD and trying to cope with 2 small babies, and then we went into lockdown. So I was living under chronic stress for a long time prior to my diagnosis. Although I probably wasn't aware of the impact of that on my health, and I wasn't as knowledgeable as I am now about the impact that that has and that chronic stress has. And I'm very much the sort of person that just goes, we'll just have to dig deeper and find a bit more and keep going. I haven't been in the past very good at asking for help. I think as soon as I got my diagnosis, it felt immediately obvious that the factors that had potentially contributed to that or played a part in it. But yeah, so I went back, was eventually went and saw a private doctor who still didn't initially have major concerns about it, and then eventually found a lump, which is a much more classic symptom of breast cancer, and we had that biopsied. And even then I was told, I'm not sugarcoating this, it's probably nothing to worry about, and discovered that there was a tumour. And then when we had scans, that we discovered that there were other smaller tumours there. And then when I had a lymph biopsy, discovered that it'd gone to lymph nodes on that side. And then I had lots of surgery and various treatments started. And then I actually had a dream about 6 months after the first diagnosis that I had the same symptoms on the other side, and I was anxious about it. And I know I'd been scanned repeatedly by this point, so I shouldn't have had any genuine concerns really, but was worried about it. It was niggling me, and my husband said to me, why don't you just ring the breast nurses and have a chat with them? They'll put your mind at rest and then you can forget about it. So I phoned them and they said, look, just pop in and see the surgeon and we can just, draw a line under it and let you get on. And because I don't think anybody took it particularly seriously. Anyway, I saw the surgeon and she said, it is quite lumpy. Shall we just double check and have another scan? And I had another scan and nothing showed up. And the doctor that did the scan said, I'm just going to do some biopsies there as well to make sure. And sure enough, I actually had a much, much larger tumour in that side, and it got picked up through, I think, probably just intuition. I think something in me knew that it was there, and I needed to go and get it explored. So I think I've been really lucky, actually, lucky that very unlucky that it was so difficult to detect. And actually, in hindsight, I've heard other people speak about this very publicly, but I think if you have dense tissue, it's very difficult to detect it. I think about 60% of women who have dense tissue, it's very difficult to diagnose or doesn't get diagnosed. And so I was unlucky in that way to be in that position, but fortunate that I was able to keep going back. And that when I went back the second time saying, this is just based on a dream, and me feeling uncomfortable about it, that was taken seriously. And we found the second one. Otherwise, I think it would have been another year before I would have had any follow-up scan as part of the sort of due process. So yeah, it wasn't easy to pick up with me. And I know that frightens people a little bit when you say that. I think people want to know that they can go and get the checks and get the scans. But I think that the point I would make about that is if it doesn't feel right still, it might not be. So keep going and keep asking questions.
So how did you cope with that at the start, with the back and two, and just having that sense that something wasn't right, and almost, I'm not saying you were dismissed because it doesn't feel like you were, but or just basically, no, there's nothing wrong, you're fine. How did you cope with that?
I think I was dismissed a little bit, Steve. I think but not by any individual. And I think all of the care that I've had and the individual doctors and nurses that have worked with me since and treated me have been amazing. But I think the system dismisses you a little bit because I think that nobody's ever trying to find any underlying cause, and nobody actually said, "Well, look, let's have a look at your whole health. Let's look at everything else because there's something going on here, whether it's cancer or not. There's something happening. There are genuine symptoms here that we need to address." And nobody does that. And actually, I've never met anybody that's been through the NHS system of cancer care, which is the best care. I was going privately to get the diagnosis and was put back into the NHS because it is the best care. But nobody ever says, why did this happen? What were the factors that contributed it? How could we prevent it happening to you again or prevent it in other people? And so I really lost trust. It's really, really difficult to then listen to the advice of doctors who have missed this repeatedly over the last 6 months and sent me home saying there isn't really a problem for you to worry about. And I found that really difficult because I think many people, when they get a diagnosis, and if they've had a very quick diagnosis, hopefully, had a problem, had it addressed and discovered that there's something there, you put all of your faith in that medical team, don't you? And you say, well, you've got the expertise, you've got the answers, you tell me what to do. And that was the bit I struggled with the most because I didn't feel able to do that and felt quite unhappy that I was at the stage that I was at and that I'd gone from there's nothing wrong to, or there is a lump, to there's multiple lumps, to it's in your lymph nodes. So it felt like this train that was surging towards a sort of stage 4 cancer diagnosis, and I desperately just needed it to stop at a station that wasn't stage 4. And so I felt a lot of resentment, and I felt really unsafe with the people that were there supposed to help me. And I think the biggest thing that I did was, and I realised, look, I've got a PhD, I can read the medical research and understand it to an extent and have a reasonable insight into what it says. But that is what I did. I took ownership of my own diagnosis, my own prognosis, and my own recovery plan. And I appointed other doctors as well. So I got second opinions. I kept the team that I was working with at the hospital and I followed their protocol, but I challenged that and I looked at other ways of approaching it and other treatment options, and could I do multiple things and not just one thing, and looked at my diet, looked at my overall health. And I think that was the biggest thing psychologically and emotionally that supported me, was actually putting the team of people around me that I felt that I could trust. And that was from friends and family to other medical professionals, and having a treatment plan that I felt was right for me and making my own decisions in that. And it is a lot of pressure. And there's a big part of me that feels that we shouldn't have to do that for ourselves. But there is some really great research around how patients who take ownership of their own recovery have actually better outcomes in that recovery. So I think that was probably one of the biggest things that helped me through.
Yeah, taking control is a big help, isn't it? When you know where you sort of working towards, it's massive. I mean, we've done getting on for a dozen of these episodes now, and it's actually frightening how many people have had similar-ish stories of not being picked up when they first go to the GP, and
Yeah.
it's really difficult. And I guess that's why there's been a change in the law recently that if you visit the doctor for 3 occasions for the same thing, they've got to do a full assessment and take it more seriously and start thinking, is this cancer? So, I mean, that's
Yeah.
got to be a positive change to the law. I mean, how did you go on for mental health support? I know you've just said you got friends and family and things, and as a psychologist, I can't imagine there's many counsellors that step forward to work with a psychologist at times, but what support were you offered?
Was offered support, psychological support, and I took it. And the lady that I dealt with was wonderful, and she did some brilliant sessions for me, but it didn't touch the sides in terms of what I needed. And that support came from my colleagues and from so I still work now. I still have sessions now with a psychologist every week as a therapist, and she is incredible. But I have found her, and I understand what qualifications that she needs to have and able to support me fully. And I get a huge amount of support from colleagues and had phenomenal support from colleagues throughout my cancer journey. So not just in relation to work and how I showed up at work and what I was able to and not able to do and how they managed that. And actually I was on a contract at the time where it was a 2-year contract, and then this bombshell came 6 months in to the contract, and it could have ruined everything, and it could have potentially put me out of a job. And it was managed so sensitively and so brilliantly. But it on top of that, I worked with clinical psychologists who held a space for me every week to come to and just talk about what I was going through and what decisions I was having to make and how I was feeling. And so I feel incredibly fortunate that I had that, and it has only reinforced the fact that I think everybody deserves that. I don't know how you deliver it. I don't know how you give everybody that level of emotional and psychological support. And I know there are some amazing charities that are doing amazing things to support, particularly women with breast cancer. I'm aware of those more than any other, but I'm sure there are lots and lots of different cancer spaces. But I think we're still falling really short of the right support for people and an education around the type of emotional and psychological support that people need, not just from the diagnosis, but why did they get the diagnosis in the first place? Like what's happening in their life? And we know now that chronic stress has a big impact on immune function and on our and directly on our health. And nobody says, well, look, what environment is this person in? What environment do we need to get them into in order to recover as well as they possibly can? And by that, I don't mean changing your job or, or cutting people out of your life, but you can change your environment by in lots of different ways, by the things that you agree to, the things that you put boundaries around, the people that you have around you at a particular time when, specifically around your diagnosis or treatment. There's lots of ways in which you can support people. And I think we're just not doing that. We're treating the physical body and we're removing cancer rather than treating the whole person. And we're certainly not even looking at emotional and psychological impacts at all.
So you are right. There are lots of amazing charities out there, and it feels like mental health support for people with a cancer diagnosis is pretty much by and large left to those charities, whether they're hospices or whether they're cancer-specific charities, or the bigger ones like Macmillan, et cetera, et
Yeah.
cetera. And Macmillan were brilliant for me when I got diagnosed. I had sort of 6 sessions with them, but 6 sessions for me helped a little bit at the time.
Not
But it's not
enough, is
enough,
it?
is it? It's not enough. Like you say, it scratches the surface, and you just start to. You then start. You start thinking, well, why am I thinking like this, and why do I respond like this? So you start to dig a little bit deeper, and often you can go back to childhood, can't you? I know it's quite stereotypical, or counsel will take you back to childhood, but that's sometimes why we do what we do
Yeah.
and respond like we do.
And it's
And in
why
6 sessions, you just can't do it.
No, and it's often why your current environment is problematic for you, but not maybe somebody else because of
Yeah, yeah,
your experiences that you're bringing to it. So I know there's this sort of, oh, everything gets blamed on childhood. It's not. It's not about blame, but our childhood shape who we are. Our childhood shape how we think about ourselves. Our childhood shape what we think we need to do in order to be lovable and to feel a sense of worth. And sometimes that shows up as overperformance or overgiving. And so it's really important if you've got a cancer diagnosis to understand that and to understand maybe ways you need boundaries or where somebody needs to help you put those boundaries in so that you're not giving all of your energy away. That's not necessarily true of everybody that's got cancer, but understanding that about yourself, I think, is really important. And I think there's two things around the psychological and emotional care around cancer, and that is there's the care about the trauma of this diagnosis because it is traumatic. Like I cannot drive past my local hospital without getting anxiety. I had an appointment recently at a hospital, a different hospital from the one I was treated in, about part of the same thing, but not an anxiety inducing appointment. I wasn't going to go and get some scan results. And I misread the message because I was just terrified by it. And I turned up on the wrong day because I'd gone, oh, yeah, right, fine. I don't want to look at that. I'll put it away. So it is traumatizing. It's massively traumatizing. So you've got the trauma of the diagnosis to support somebody with. And then you've got the context of, well, what was going on in your life that maybe contributed to this? So is there stress? Is chronic relational or emotional stress that's happening? But what environment do we need to create for you? Or what do you need as a patient to think about in terms of your needs, your emotional and psychological needs, in order to recover well? So I think there's those two things. It's the sort of firefighting the immediate, how do we support you through this trauma? And then there's the bigger picture of what things might we address about how you got here to make sure that those things don't carry on the other side of recovery, and that we can support that recovery as best as possible.
And you are right about trauma, because obviously everybody is in a different situation when they get diagnosed. Some people are working, not working, can't work, can work, got good employers, bad employers. So then finances come into it, relationships with family members come into it. There's a whole host of other things that come with it, isn't it? And I hit so often, not just in the counselling world, but just in society really. Oh, well, we've cut the cancer out if it's surgical. You're fine now. Everything's okay. Well, the mountain of debt I've ended up in because I couldn't pay my mortgage, etc., isn't just going to magically go away, is it?
No. And even if those knock-on effects weren't true, and they are for many people, they're real concerns, aren't they? Genuine, legitimate concerns around finances and but you're just not the same person. Your anxiety about any little tweak or twinge or pain or discomfort, or your body feeling differently, you catastrophize the way that just I don't we would expect anybody to go through any other kind of trauma and then not acknowledge the impact that that has. And I think because sadly cancer is so common, 1 in 2 of us will be diagnosed. It's so unbelievably common now that everybody we know either has had it or knows somebody who's had it, a very close person to them. So it's not something that's out there, and I think that's easy to normalise and easy to dismiss it as being, well, lots of people get it and they just get on with their lives. And I don't think that's true. I don't think you ever feel the same afterwards. I think there's all sorts of things that change, and it has profound impacts, doesn't it, on other areas of your life that people just don't expect.
Absolutely. And I'd be really interested to get your thoughts on something I've spoken about on here before. When I was doing my psychotherapy degree, I did a literature review on mental health in a cancer diagnosis. And I was struck by how much I think lazily, gets labeled as anxiety and depression, when
Yeah.
actually, if you strip underneath it, it's fear of reoccurrence, fear of progression, and fear of death, basically, and fear of the unknown more than anything. And that's debilitating. And if you can get the right support for somebody just to home in on those issues, it's not general anxiety and depression, which are obviously conditions in their own right, but so generalized at times, isn't it? The support that is available.
Yeah, I think that's really true, and that's really interesting research. It's a really interesting project, and I think you're 100% right. I think to say that anybody after a cancer diagnosis has generalized anxiety and not look at the cause of that is bonkers, isn't it? Because how could that not contribute to it? But I also think we see that in general as well, Steve. I think we talk about generalized anxiety, and often it is chronic relational and emotional stress or psychological stress. And I think the things I talk quite a lot about psychological safety. And it's a concept that's been used in the workplace a lot, of having psychologically safe environments for people. But I think it's true within lots of areas of our life. And in my job, when we talk about environment, we actually write a list of individuals that make up that environment. So if I'm talking about an athlete's environment, I'll be talking about their family environment. Do they live in their family of origin with parents? Do they live somewhere else? Their training environment, their match environment, their team of coaches and support staff, but also organizational bosses that might influence lots of parts of their training on their day-to-day life. And so we look at lots of different areas. It's not just your physical environment. And actually, psychological safety is around being able to be yourself without fear of rejection or abandonment or humiliation. And I think there are lots of ways in which we don't always feel psychologically safe. And that shows up then as a generalized anxiety, or is put down to well, because we can't quite name why we don't feel safe. And it's not a physical safety. We're not concerned about physical safety, but psychologically we don't feel safe to say something to somebody, or challenge something, or put a boundary in with them, or push back on something that we didn't like, or say no. And that just manifests to us as this sort of generalized anxiety. And I think it's amazing how common that is actually, and the number of people that I've spoken to since my own diagnosis who've had some sort of cancer diagnosis. And again, largely I'm speaking to women who've had breast cancer diagnosis like me, but all sorts of people. And you start to see the patterns of that showing up in their lives. And that chronic stress, I think, is contributing to ill health. I think certainly without making it a gender issue, but I think it's very obvious for women in terms of the expectations on us around motherhood and working and all of the stresses that we have around that as well. But as you say, it gets dismissed as this sort of generalized anxiety, and it's the sort of thing that I think is really useful to address when you've had any chronic illness diagnosis. Is like, actually, do I feel safe? Do I feel safe physically, emotionally, psychologically with the people that I'm with and the environments that I'm in? Because if I don't, that's going to impact on my recovery, and I need to address that.
Yeah, and emotions play a big part, don't they? A lot of the work I do is around emotions. Emotions control people, don't they? And they actually can't. They can't physically control somebody. But unless we recognize what those emotions are, it's really difficult to address, isn't it? I'm a bit of a worshipper of Susan David. I don't know if you've come across Susan's work.
I,
She talked about emotions being data. And if you don't deal with the data, then it's going to come back to you.
yeah,
And she did a really good TED talk on YouTube. It's fascinating. If you get 15 minutes to listen to it,
I
it's
know.
really, really good. And she's done her own sort of guesting on podcasts. She's fantastic. But it's like if you were a salesman, isn't it? You would, if you got quarter one, three, and four great sales, but quarter two was down, if you don't address that, it's coming back, isn't it? And
Yeah,
if you can actually work, because you must have heard this a million times like I have. If you have got a diagnosis, for example, how many people say stay positive? Just stay positive, everything will be okay. And it's like, well, if I'm not positive, because I can't really be positive about this, therefore society says I'm negative. But they're just two emotions. How many other emotions are there? Sadness, fear, etc., etc. It's
yeah.
bonkers, isn't it? Our society expects us to be positive.
Do you see any particular do you see patterns in that? Is it often the same emotions that people are dealing with, do you think? Or is it very different from one person to the next?
I think it is different depending on sort of age of patient, gender, home setup. But the one that comes back time and time again is fear, fear,
Mm,
fear, fear. And we ruminate with that fear of what's happened before. And
yeah,
that, well, the general word is anxiety when it comes to
yeah,
scans and what's going to happen, who am I going to leave behind if this doesn't go well. Yeah, there's so much fear in there.
yeah. And our brains
And
are
I,
pattern
and
recognition machines, aren't they? So we take what happened and we project and say, well, therefore, how do I avoid that happening again? But there's a couple of things in what you said, and one in particular is actually I couldn't agree more about being able to be honest about your emotions, and actually what is becomes profoundly obvious, sadly, I think to most people that have had a diagnosis is the inability of other people to sit with that. And the discomfort that they feel about you saying, I'm having a really rubbish day and I feel really down, or I'm terrified about this, or I'm scared. And people want to solve it. And when they can't solve it, they just say, well, just switch those feelings off or those thoughts off and don't have them. And it can be really invalidating, can't it? Because actually, we just need someone to hear us say, this is awful and I'm frightened, I'm terrified, and I don't know what to do with that fear.
But I think I work a lot with acceptance, and it's knowing where you can get the support you need from for me. And I hear so often, so and so just doesn't talk to me about it, or they think it's
Yeah.
all done and dusted and things. And people don't understand what their network actually is. And I often give a sort of a general scenario of if you've got a single mum who's going through treatment for cancer, and all they want is the emotional hug from their mum. Every time they go around to their mum, it's not there. So you're setting yourself up to be disappointed every time you go because mum's never been a hugger. In all the life, as a child growing up, she's never hugged me. But what mum does do is she picks up my child from school. She makes sure they've got tea,
Mm,
makes sure they've got everything they need whilst I'm going through cancer treatment. If you can accept what you do and don't get from there, so you don't get it from there, but where can I get it from? Can I get it from a friend? Can I get it from a sibling? Can I get it from a professional service if it's not there? But I wouldn't be able to go through the chemotherapy if mum wasn't doing that for me. And you start to see people in a different light and stop setting yourself up to be disappointed.
yeah, I think there's There's a couple of things in that. One is allowing yourself to grieve that first and say, I should have that from that person, and I should be what I get. And doing that bit first, I think, then helps with the acceptance piece, doesn't it? Of saying, okay, but I don't. And the other thing I think is around, and I can't take credit for this. This is a brilliant psychologist that I work with, who said to me once about how the opposite of helplessness is choice. And I think there's nothing there are lots of things that might make us feel helpless, but a cancer diagnosis is certainly up there. And some of the treatments and surgeries and things that have to happen after that, we don't have a choice about, or we don't feel we have a choice about. And so actually giving people, putting them in a position where they feel they have some choice, and it's not hopeless. So, and that's what I mean about providing that support for people, so that if that single mum whose mum doesn't do the thing that she needs her to do, and provide that support, or there aren't friends around, where does she go so that she says, look, I have a choice, and I could go to this person instead, or I can go to this support group, or I can talk to this counsellor, or I could. And that choice, I think, is really important, and it's really empowering. And it's such an important part of cancer recovery, is finding ways in which you do have some choice, because so much of it makes you feel incredibly helpless.
Absolutely. Before we go on, I just want to touch on or mention a second sponsor of the show that we have, which is a company called The Resilience Room. The Resilience Room is a training company offering a number of in-person training courses. Too much training these days because it's become a tick box online bore, but the Resilience Room understands the power of getting in the room with each other. Current courses on offer include Wellbeing in the Workplace and Loss and Grief. All courses can be bespoke and tailored to the needs of your employees. So have a look at the Resilience Room website on www.resilienceroom.co.uk. So you've had your first diagnosis after a few back and twos. You've told how the second diagnosis came around. How did it feel for that to come back, if that's not a crazy question?
No, it's not a crazy question at all. It's a difficult one to answer though, because it's, as with most things to do with cancer, it was very mixed feelings. One was a relief that we caught it when we did, and that didn't go on. And that can feel quite tentative as well, can't it? Because it came out of something so fragile, in that, if I dismissed that dream, or if somebody else had dismissed it, I'd probably go, yeah, I'm being silly, and have packed it away. So on the one hand, there's a huge relief that we'd caught it. On the second, on the other hand, a real fear that it took that to catch it, as opposed to there being a process that I could have moved through. What if I hadn't had the dream? What if I hadn't told anybody about it? And I think also, talking about other people's responses, but I think a lot of people kind of took the view, well, but the drill, like, what's going to happen. And it's like, that for me was the worst bit, mm, was that I knew what was going to happen. I knew how this was going to go, and I knew what I was going to have to go through again and endure again. And that I think was harder in some ways the second time. It's that thing. It's not binary, is it? I mean, there were things about that at least kind of relieve some anxiety. If I know what to expect, I know what tests and scans are going to happen now, and I know what surgery or treatment might happen. But knowing it doesn't make it any less painful to go through. I don't mean physically, I mean emotionally. Physically as well, but emotionally painful to go through. My children were really young when I was diagnosed as well, and that was one of my biggest fears. Was they were 5 and 7 when I got my first diagnosis, and my immediate concern was around them and their well-being and their fears. And I did a lot to try and manage that, and to try and support them. And so to have to tell them and I tried not to use language like it had come back, because I didn't believe it had come back. I believe it was always there. And that was the advice I got from some, very, very good oncologists. Said, I can't believe that it's got that big in that space of time. It was there, and just not picked up. So that's how I try to frame it to my kids as well, that we've just found some more, and it's good that we found it and that we've dealt with it. But yeah, it was, I think in some ways it was harder, and you sort of, I thought I was getting to the light at the end of the tunnel, and then you go and you just have this, you dump back down on your backside at the beginning again, going, oh, right, okay, we're back to square one, and we've got to do this all again. And to find the resilience and the energy was hard. And so I didn't try to start with. I didn't just try and I've always I've always rejected the battle narrative. I know that works for some people, and it's not a criticism. I personally don't think it's helpful. For me, I wanted to. My diagnosis was a bit of a wake up call that I hadn't been looking after myself, and I hadn't been attuned to what I needed on any level, really, physically or emotionally. And I needed to start tuning into that, and I needed to be on side with my body and not fight it. I didn't think my body had betrayed me or let me down. In fact, quite the opposite. And I used to refer to it as my body having a bit of a tantrum. It's like, if you're not going to listen to me, then I'm going to make you listen to me. And so I did start listening and just realized that I needed a lot of rest and a lot of care and a lot of nourishment and love and support and kindness. And I tried to lean into all of those things rather than battle and endure and fight. And I think because chronic stress had led me to my diagnosis, if that was the fight, I wasn't going to win it. I had nothing left. And I did a load of hormone testing actually after my initial diagnosis. Can't remember if it was after the first one or in between the two. And I was struggling with burnout. I was really close to a serious burnout diagnosis as well. And so that to me was the wake up call that didn't have the energy to fight it. I had to just take a different approach. I had to see it as, no, it's the only body I've got. It's got to last me the rest of my life, however long that is, and I need to take some really, really good care of it.
Well, I mean, if ever somebody was able to take their work into their own sort of life to make the positive changes, this really sounds like this was it.
Yeah, and each to their own. Everyone will find their own way of doing it. But absolutely for me, I just couldn't fight it. I couldn't take that approach. It just didn't feel like an option. I think I'd been fighting so much already and trying to stay afloat so much already and juggle so many balls and not drop any, that this was the sign I needed to say, you've got to strip your life back. You've got to make some big changes. But you do have to be willing to do that. It's hard work. I changed a lot about my life and gave it a complete overhaul and still am doing. And it's not easy. It's really not easy, but it's never felt like an option to me. It's felt like life or death. I need to. And I've got two young kids and I'm not going anywhere. So I have to do it. And so I've overhauled probably to extremes and I've rattled it back. So diet went very extreme. I almost, was frightened of eating anything, drinking anything because, everything's cancerous and going to kill you if you believe everything you read. So I probably went to extremes and I needed to do that to feel safe. And then I've gently kind of softened that and realized that also isn't a very healthy position to take. Any sort of extreme protocol is probably causing as much stress as it's relieving. So you need to just bring it back to something that's more manageable. But yeah, it's definitely been the right approach for me, 100%.
Fantastic. You mentioned a little while ago about you think there should be more available sort of psychologically for people diagnosed with cancer. It's $1 million question, isn't it? Because there isn't $1 million really. How do we do that as a country and as a society? The NHS is on its knees financially, as we know. How do we do that?
I don't know the answer either. I wish I did. I think, as I said, the work that charities are doing, I think, is phenomenal. I think it's personal preference, isn't it? And where people direct their money. But again, I think since my diagnosis, if I raise any money for cancer, I put it towards those charities that are supporting people. I think educating those people as well and trying to do something at that level and understanding the level of support that people need. I think things only shift when people jump up and down and shout about it. And I think I need more people to be outraged that they're not getting that support and not getting that help and talking about that and saying how little emotional and psychological support there is. I think just, yeah, it's a bit of an education piece. I think that the bit around research, I get really frustrated around. We put a lot of money, it's like pharmaceutical drugs companies put a lot of money into researching the outcome of their drugs, but there are also lots of other ways in which we need to support cancer, and there just isn't the money there to research that. But I think more research around the psychological and emotional impacts of chronic stress and the impact of that on our well-being and the impact of that on cancer in the first place, and the support then that people need and how that might impact recovery, I think would be really important. But just to keep the conversation around it alive, I think at this point is really helpful.
I don't think that has to come always down to government and government funding, does it? I think employers can do more to help them. And I mentioned a sponsor of the show a minute ago, the Resilience Room. You've probably seen that's actually my
I've had a
company,
look at
my
it
new
actually, Steve. It
company.
looks amazing. Yeah.
It's a brand new something that we've just taken off the ground. And that's what we're aiming at really is well-being in the workplace, get in there and how to recognize that stress. I was in, let's say I was in a prison a couple of weeks ago, delivering one of these courses to management and how to recognize that on actual prison officers. Because obviously that's the ground level, and if managers don't spot it, you can't well, you're not gonna pick it up till somebody goes off sick, and if we can just get that education into employers, and then employers can use employee assistance programs, which then gets you counselling, which isn't a massive number of sessions, but it's a start when somebody's first been
Yeah.
diagnosed. I think that's the way forward too. I think, it doesn't always have to come from the NHS and government.
No, I would agree with that. I think the stuff that you're doing with the resilience room is brilliant. I had a look at it the other day and I think it's awesome. I completely agree. I think we pathologize well-being. I think well-being becomes something that is fluffy and nice to have until at which point we give it a diagnosis. And then when someone has a diagnosis or a label, then it gets medicalized and treated as a separate thing. And they exit the workplace in order to be treated and then they come back in. And it's the same within sport. We do exactly the same thing with athletes. And actually, performance and well-being are symbiotic. They are interconnected. You cannot perform well in an environment that you're not thriving in, and if you're not thriving in that environment, then your well-being is not being addressed. And so that we need to understand the interaction between that more and the environments that we're creating for people. And I think, as said, for individual patients, anyone who has a chronic illness diagnosis, to understand what are your environments, not just the workplace, but your family, friends, all sorts of environments that you're in and the people that are surrounding you, and to think about who those people are and whether they give you energy and build you up and make you feel better and allow you to be yourself, or are they taking something out of the pot in terms of energy and emotions? And as a recovery, you've got to prioritize the things that are topping that up and not draining it. And I think that's really important.
Absolutely. I mean, we're coming towards the end of the episode. How are you doing with your health now? How are you managing?
Touch words. I'm doing really well, thank you. I'm still having treatment and I've still got more surgery to come, but that's elective surgery as opposed to anything life-saving. But yes, so another year to go on the current treatment program that I'm on, and then there's a longer term maintenance. I don't think you, as you know, I think when I was diagnosed, I thought there'd be this moment in time where I'd ring a bell and that would be it, and I'd never have to think about it ever again. And it doesn't ever quite work like that, does it? You never
Yeah,
quite get to the end and you never quite feel that you can just completely relax and not think about it anymore. But yeah, another 12 months and certainly my life will change in terms of treatment, which will be good. And then the idea is just to stay fit and healthy after that. So yeah, doing really well, thank you.
good, good. And I hope the next 12 months goes as well as it can do for you. I mean,
Thank you.
just touching on something you said there psychologically, that ringing of the bell. I remember talking to Sharon about this on an earlier episode. A lot of people who aren't in the cancer world assume ringing the bell means that's it, it's over. It
Yes, it
doesn't.
doesn't,
It
does
just
it?
means it's the end of chemotherapy. It does not mean this is all over. And so many people see an image of somebody ringing the bell going, oh, they're okay then now.
I know
And
it's
everything must be
interesting,
okay.
isn't it? Yeah, and so I've taken ownership of that one personally for me, and my husband took me on a date recently, and we just went for a walk, and there's a statue near our house. We live in rural Dorset, and there's a structure, and it's got a bell at the top, and it's a tribute to farmers and farming community. And there's a bell, and we just went there, and I got to ring that bell, and we just decided that there are going to be loads of bells and different milestones we're going to celebrate and ring a bell and ring our own bell, and there doesn't have to just be one, because there isn't this defining moment, is there? I thought there was. I think as many people, as you said, you sort of naively think ring the bell and that's it. You're all done forevermore, and it just doesn't mean that. And so, yeah, ring lots of bells, ring your own bells, and celebrate every milestone because they all matter and they're all important.
Absolutely. And what I said is definitely not to diminish those that do ring the bell for finishing chemotherapy because
No,
that
it's
is one heck of
amazing.
an achievement.
Yeah,
But yeah, it's not what it symbolizes or a lot of people think it symbolizes.
and it doesn't have to be the only one that you ring.
No, Absolutely. Alex, thank you so much for your time today. I'm sure our listeners will be inspired by
Absolute
what you've been
pleasure.
through and what you've discussed. I want to again thank our sponsors, the Resilience Room and Corporate Wellbeing Solutions. Also, I want to say that I hope you are enjoying listening to these podcasts. And if so, I'd like to ask a little favor. Could you please leave a review of the podcast on whichever platform you get it from? This helps raise the profile and helps enable more interesting guests joining the podcast. If you want more information on the services I provide, such as counselling and public speaking, please visit my website on www.stevepoyntoncounsellinandsupport.co.uk. So that's it for today's episode. I will speak to you all again soon.